Why do people develop autoimmune diseases? One of my patients had gone with her family on a nice, beautiful vacation. Unfortunately, they got sick. They had salmonella food poisoning. It took them a while to resolve it, and they all got better except for her son, who was one of identical twins. And the son, she brought her son to the clinic, and he had swollen joints, and it looked like he had developed an autoimmune disease. This is interesting because he had an identical twin, and everybody got sick. But why is he the one, right? So the question she asked is, well, why is he developing an autoimmune disease? And well, how do people even develop this thing, right? So my name is Dr. Arinola Dada. I am a rheumatologist in the greater Seattle area. I help people with joint pain become pain-free, and people who are dealing with an autoimmune disease get their immune system back on track. So let's talk about why people develop autoimmune diseases, and then we kind of talk about my patient's son too, right? Okay, so first of all, if we think about our body as a country and the immune system as like the body's military, okay? So the military's job is to protect the body from foreign invaders and domestic invaders, right? So foreign invaders would be like bacteria and viruses. That's why we don't get sick every time we come in contact with a bacterial infection. And the other function is to protect us from internal invaders. So the internal invaders in the body's case is like cancers, right? Or wayward cells, right? So that's the body, that's the immune system's job. But when people develop an autoimmune disease, you know that something has gone drastically wrong, because now the military is pointing its guns on the populace, your cells, right? So that is what's happening in an autoimmune condition. So let's talk about why, and then I think we can wrap in what happened to my son's child, right? Okay, so the first thing is, generally, I think autoimmune diseases, the way to look at it is cells go through a cycle, right? And when the cell can live, cells live and they die, and it's programmed. And the way they live and die is programmed, and they have a cell death cycle. Now, it sounds kind of funky. Why do cells die? But cells die. Remember when your skin gets sloughed off? That used to be skin, right? And then it's dry, and then it's dead, and it's gone. Yeah. So the body goes through those cycles, but it's programmed the way they die. So the cells that are inside your body, obviously, they're not going to slough off your skin, right? So the cells inside the body that also kind of have their life cycle, and then they die. But when they die, they're supposed to die in an organized fashion called apoptosis. They die in an organized fashion. So organized means it's time for you to die. You crumple up. I think like you can imagine like a piece of paper crumples up, and then you break up into tiny bits, and something comes, kind of like called a macrophage, comes and chomps up those tiny bits. It goes to the liver and spleen. It gets taken care of. No debris. Everything is clean. It is organized. It is orchestrated. That is what normal cell death is supposed to be. It's like trash day. You take your trash to the trash can, you take it to the curb, the trash guy comes, he takes the trash, he puts it in the trash vehicle, and they zoom off, and there is no particles left behind. That is nice. It is orchestrated. It is organized. That's normal cell cycle. But in an autoimmune condition, okay, the cells, when they die instead of dying like a crumpling of a piece of paper, they die by explosion. Psh, everywhere. So now you have all this nuclear debris everywhere. So the macrophages come, they try to pick up a few things like the trash man is, but they're not going to succeed. So you're going to end up with some nuclear debris all over the place. So then the body is saying, well, what is this? Remember, it is supposed to protect us from foreign invaders and domestic invaders. So it's looking at nuclear debris, and it's like, well, I've never seen this before, because all along it's always been cleared off neatly in trash bags, right? Now it's finding nuclear debris. So what does it do? It says antibodies. Time to get to action. There are some invaders here, and it forms antibodies against all this nuclear debris. Well, we have nuclear debris everywhere. We have nucleus everywhere. So the body can now develop antibodies against any part of us, right? And so it's like on a trash day when it is raining and windy. This is Seattle, happens all the time. You find your trash just skewered everywhere, right? And so the trash man is going to do his best, but there's going to be trash everywhere. So same thing. skin, you develop these antibodies because there's nuclear debris everywhere. And that is one of the ways in which autoimmune diseases happen. The second one, which is what happened to my patient's son, is that, again, they had an infection. Everybody in the family got the infection. But for some people that are prone to it, when he had a salmonella infection, there is a part on the cell of the salmonella that kind of looks like it has the same amino acid sequence as some of the cells in our joints. So when his body mounted an antibody, which was appropriate, there is an invader. It launched an antibody against salmonella and it destroyed the salmonella, and salmonella was gone. But the body remembers. For those people from Game of Thrones, the North remembers. The body remembers that it once came across salmonella, and it has like soldiers that if salmonella dare set its foot